And when there's intense pain, a couple of things happen. But uh, One of the best techniques to treat intense pain, because pain is a concentration of chi, right? Pain is not a real thing, it's a concentration of chi. And then that concentrated chi sends off a sensation we call pain, okay? Is to deplete the amount of chi. So a lot of pain formulas in a healthy or otherwise robust person are going to be very heavily da huang. And one of the things that you'll see is da huang is used and it says, oh, stasis of blood, etc. But you take a person who's in a lot of pain and you give them a lot of da huang and they have a lot of big bowel movements, so much chi is drained out of them that what they have for pain is more like, right? Which is seen as an improvement. And you've got the system flushing stuff out. But you do that to a depleted person who has intense pain, and you just make the pain worse because they have less resiliency to the pain they have. Does that make sense? Okay. So in a person like the person we're mentioning, they would probably have blood mover, bowel mover herbs uh, gathered in together, and then if they can stomach it, uh, nothing is better than Ruxiang Moya Woolinger, right? For just Chinese medicine, pain 101 when not using Ying Su Ke, right? Opium, poppy husks. So please don't forget that the Chinese, they used strychnine, they used arsenic, they used opium, poppy, they used all the things that we use today. And just because it has a name we don't know what it means or because it's natural doesn't mean it doesn't kick butt. But the use of strychnine was very common in trauma medicines.